We've heard about the newest drug for rapid weight loss, which is Ozempic, not originally a weight loss drug, but that's what it's being used for now. So, can you tell us what is Ozempic?
Ozempic is a drug that's been approved by the FDA to treat type 2 diabetes, to decrease blood sugar levels. And it's a GLP-1 agonist. That's just a fancy way for us to say that it mimics the normal hormone GLP-1 in your body. And what that does is that it stimulates your pancreas to secrete insulin, which then decreases blood sugar levels. And that's why it's so effective for diabetics to decrease their blood sugar levels.
So, this isn't insulin, right?
It's not insulin. It's definitely not insulin, but it helps the body secrete insulin, which then decreases your blood sugar levels.
Sure. So, it's originally used to treat type 2 diabetes. So, how did people find out, oh, this also is really good at weight loss?
Absolutely. So Wegovy, which is another drug that's in the same class, which has the same active ingredient as Ozempic, is used and FDA approved to treat obesity. But there's been a shortage of Wegovy, so a lot of people have, turned to Ozempic to treat obesity and to try to lose weight. And there's been a huge emphasis of Ozempic on social media, which has really triggered a lot of people to sort of use this drug for weight loss, even though it hasn't been FDA approved for weight loss.
And I want to talk about the impacts that it has on people who actually need it. How is this impacting people who have type 2 diabetes and rely on Ozempic?
It's having a huge impact because unfortunately what's happening is people are using this drug to lose weight. They want to use the drug to shed 5 or 10 pounds before a wedding or something like that, but that's decreasing the supply of Ozempic for people that actually really need it. And the people that need it are type 2 diabetics, who want to decrease their blood sugar levels. So unfortunately, it's halting them from using the drug that they really need.
You mentioned that people are using this to shed just a few pounds for events like a wedding. That doesn't sound like they need it really for health reasons. So, how are they getting their hands on Ozempic?
Well, I think, from the COVID-19 pandemic, there's been a lot of change in the way people are getting medication. So now there's, telehealth, people are able to get the medicine online by, filling out prescriptions that then, doctors that use DigiHealth and telehealth are able to prescribe. And it's increased access to drugs. And in some cases, this access is good. It's allowing there to be, more transparency and more availability of health services. But in other instances, it may not be very good and very effective for the public health at large because doctors who are prescribing these don't know the whole history and don't know the big picture of patients without actually seeing them face to face. So it can have detrimental consequences. And unfortunately, this is how people are getting Ozempic, fairly easily in the market.
Sure. And I do want to talk about the side effects here. I mean, first and foremost, is this safe to use for weight loss if you aren't a type 2 diabetic?
So in general, Ozempic is a very safe drug for type 2 diabetics. It doesn't have, that many serious side effects. Common side effects are things like nausea, vomiting, constipation, diarrhea. In a small percentage of patients, there are more serious side effects like inflammation to your pancreas, inflammation to your gallbladder. You can have hypoglycemia or low blood sugar levels, and you can actually have an allergy to the active ingredient semaglutide. So if you do have, itching in your throat, you develop a rash, you have difficulty breathing, you may have an allergy and you should see your doctor immediately. But patients that don't have type 2 diabetes shouldn't really take this drug. It is effective in weight loss, but you're preventing people from who actually really need it getting the drug. And on top of that, there are side effects that we just talked about that should be considered.